Okay, good morning, everyone. I guess that we are ready to start. So good morning and a very warm welcome to all. And thank you very much for joining us this morning to partake in a very important conversation on domestic violence in Malaysia in the time of the COVID-19 pandemic. I'm Pei Zhong. I'm a senior analyst with the Penang Institute, and I will be your host and your moderator for today's webinar. So a little bit of background as to why we organized this webinar with the embassy. So Penang Institute as the state government's think tank. So we have been undertaking various research and analysis based on various socio-economic issues centering around the pandemic since the beginning of the MCO. And domestic violence and the safety of women is one of the main topics of research. And as we all know, the government had enforced movement restrictions and lockdown orders as a measure to contain the virus and to protect the individuals from infection. So staying at home means staying safe. That's the tagline, you know. But however, the research has shown that for survivors of domestic violence, home is actually the more dangerous place for them to be. The MCO has made it infinitely difficult for the survivors to leave and to seek a safe place from their perpetrators. So abusers had also made use of the MCO and the pandemic to isolate their targets, to overtly exercise control and to heighten their abuse. Indeed, the prolonged periods of confinement can potentially result in increasing frequency and severity of abuse, both physically and psychologically. So for Penang specifically, our state-based NGOs, Women's Center for Change and Stiha Malaysia, they had reported an increase in the volume of distress calls relating to domestic violence in the first few weeks of the MCO. So on the back of this research, the Embassy of the Kingdom of the Netherlands, who plays great importance in issues involving the protection of women, girls, and their equal rights, had asked for Penang Institute's collaboration in having a discussion on domestic violence in these unprecedented times through a national lens. So it was proposed that we look at experiences and challenges of survivors in different regions of Malaysia, and whether do these challenges differ from a geographical and social cultural point of view, and as well to discuss what are the interventions and policy solutions that needs to be advocated to protect the survivors under these extraordinary circumstances. So, which brings all of us here today. So before we formally begin, the Ambassador of the Kingdom of the Netherlands, His Excellency Art Jacobi, has a few words of welcome for us.
Good morning, everyone. Welcome and thank you for attending today's webinar. This webinar is organized jointly by the Netherlands Embassy and the Penang Institute on Domestic Violence. The pandemic has undeniably impacted our daily routine in unprecedented ways. Movements were restricted and soon we found ourselves staying at home. We adapted to the new norms in order to curb virus transmissions. Unfortunately for some, staying at home does not mean being safe. In some unfortunate cases, staying at home translated into emotional and physical abuse by a partner. While men also can suffer from domestic abuse, it mainly affects women. In Malaysia, the movement control order imposed by the government resulted in a spike in domestic violence cases. The webinar today is especially organized to address this situation and what can be done to assist those in need of help. No one should be subjected to abuse, and the Embassy of the Netherlands in Malaysia is committed to support activities that uphold the principles, the values and virtues of human rights. I hope this webinar contributes to ameliorating the situation. It is a pleasure to be part of this webinar and I really thank you for joining us today. Thank you.
Thank you, Your Excellency, for your warm welcome. Now, the Executive Director of Penang Institute, Dr. Wing Kee Beng, would also like to say a few words.
Good morning and warm greetings to all of you. Firstly, I would like to thank our partner, the Embassy of the Kingdom of the Netherlands, for their collaborative efforts in making this webinar a reality. I would also like to extend my warmest gratitude to our esteemed speakers for agreeing to be part of the panel today. As we are all aware, domestic violence has been an extremely concerning issue during the COVID-19 lockdown. Not only have the lockdown measures posed greater challenges to survivors seeking help, but the frequency and severity of abuses may have escalated under the confining conditions of the lockdown, alongside increasing economic pressure on poorer households. Therefore, an important conversation is needed on how we can provide the best possible support to domestic violence survivors. Penang Institute will be publishing today's proceedings in some form soon after the event. With that, I wish you all a fruitful and engaging session, and I thank you again for your participation in this webinar.
Okay, thank you, Dr. Uy. So a few housekeeping rules before we begin. So as you had seen earlier from the welcoming slides, there will be a Q&A session with the speakers after the panel discussion. So please use the Q&A box. So please enter your questions in the chat box. State your name and your organization if you are representing an organization, and we will try our best to answer it. You may also specify the speaker, a specific speaker to answer your question if you wish to. And questions can also be asked in Bahasa Malaysia, so you can use Bahasa as well to ask your questions. Okay, without further ado, let's get into the topic of today's discussion. So first of all, please allow me to introduce our distinguished speakers. We have 4 speakers with us today. First off, we have Prof. Noraida Endut, the Director of the Center of Research on Women and Gender, also known as CANITA in USM. She is trained in the field of law and embarked on women's and gender research at the School of Oriental and African Studies in the University of London, where she wrote a PhD thesis on the legal aspects of domestic violence in Malaysia. Prof. Noraida was part of the team that had initiated the establishment of CANITA, and she has been on its academic board and management team since 2001. Her research work centers around violence against women, women and the Sharia law, gender with regards to work, masculinity and sustainable development, and women and technology. Next, we have Wan Siti Hawa Ali, who is a trained social work educator and practitioner. She's a founding member of WCC in Penang and has been working on the issue of domestic violence, intimate partner violence, and child maltreatment as a service provider, advocator, and researcher since 1984. As a lecturer with USM, Wan Siti led research on the health impact of intimate partner violence in addition to researching gender and domestic violence issues. She has been an advocate for One Stop Crisis Center since 1995. Presently, she is the chair of the Education Committee for the Reproductive Health Association of Kelantan, also known as REHAB, as well as the Federation of Reproductive Health Association Malaysia. Winnie Yee is a founding member and current president of Sabah Women Action Resource Group, also known as SAWO, where she is responsible for the development and management of the service and advocacy programs at SAWO. She also initiated and implemented a rural outreach program in 2013 in setting up local support groups in 5 districts to take up awareness and networking activities on gender-based violence. Winnie is also a council member of the Sabah Women Advisory Council and the inaugural chair of the Gender Awareness Committee. Our last speaker for today is Shazana Akha. She is the head of research at Women's Aid Organization, also known as WAO. In the last 10 years, she has actively participated in various research and outreach initiatives on gender equality, children's participation, and has a keen interest in social development issues of Malaysia. She graduated from Monash University and obtained a Master's of Arts by Research in the area of Gender Studies from the University of Malaysia. A warm welcome to all our speakers. So, jumping into the first question that I have for all our speakers today. So, we know that even in the normal times where there's no pandemic, there's no lockdown, it has never really been easy for domestic violence survivors to be seeking help. So under these circumstances, in the times of COVID and the MCO, I just want to explore what are some of the difficulties that has been exacerbated, that has been made worse, that we need to pay attention to with regards to looking at regional differences in Malaysia. So if we can start with perhaps Shazana and Prof. Noraida. So in challenges in the urban areas, so what are the challenges faced by the women?
Hi, Pejun. Sorry, was it me or Prof. Noraida?
Sorry, Shazana, you can go first.
Okay,
Yeah.
all right. So just to share with you that I think one of the main difficulty faced during the MCO was basically how does a survivor escape from an abusive situation and access protection and support, given that restricted movement and social distancing measures were in place. So you see that the survivors' usual routines were disrupted. You see that their own social support systems were disrupted, and even access to government systems were restricted. So all these disruptions definitely affected survivors' ability to remove themselves from an abusive situation. And I remember for WAO in the beginning, in the initial phase of the MCO, what we saw was a lot of uncertainty around access to protection and support systems. So you see, we saw that frontline officers themselves were a little unclear about how to provide support for survivors, and survivors themselves were unclear. And we had even lawyers calling us and asking us, can survivors apply for interim protection orders during this time? So there was a lot of uncertainty in the initial phase of the MCO, and this, I think, we had raised this to the ministry lah, because important things like access to shelter was not considered an essential service. So a WAO, our own shelter, we could not operate our own shelter, and so when we received calls from survivors in distress and who were looking for shelter, we were unable at that point to provide any kind of alternatives. So, for instance, they would call us and we would say, look, try to go to your family or friends, try to look for protection within your own support systems, because we weren't able to refer them to any shelters. So I think that was a critical support system that was needed during the MCO, given the increase in calls and WhatsApps to our hotline. Yeah. So I just wanted to highlight that one main challenge or difficulty.
Thank you. Prof. Noraida, so if I can have some of your thoughts based on your research that you have done for so many years in domestic violence, what are some of the other issues you can point out besides what has been said by Shazana?
Thank you, Pei Jung, and thank you to the organizers for inviting me to this webinar. I think the key points in the challenges, I want to make a point that there are challenges for both the urban and rural survivors of domestic violence especially I suppose during COVID-19, because although we found that in our research, out of the women who have experienced intimate partner violence, 51% are from the urban areas, and the others are from 59% are from the urban areas, and the others 41% are from the rural areas. This does not mean that there are less women experiencing violence in the rural areas. They may not have access to interventions as for urban women. So I think even when we say that the challenges may be, I mean, as Shazana mentioned, challenges for urban women in getting help, the challenges may be manifold or double for the women in the rural areas, because there's not much research that has really been done in the context of rural women for domestic violence.
Thank you, Prof. Narayda. So, Prof. Siti, so your work basically centers around the east coast of Malaysia. Is there anything that you can share with us regarding the difficulties that domestic violence survivors face, especially under the lockdown conditions?
Thank you, Pedro. Assalamualaikum and good morning, all the participants and speakers. Yes, I think Shazana and Narayda has highlighted the issues, and it's not much different for the rural areas, except that I wanted to say, first of all, our concern about a community like in the East Coast community, where this issue has not been really well discussed and really well promoted. So pandemic just, I think, helped to regress it. Because it takes a long, we did not get the opportunity to, to share more with people about this issue. So the question, I think the pandemic has really hit at the core of the triggers of violence. For example, financial issues. So for us in the rural areas, for example, many of these women and their families and their partners are daily wage earners. And what happened during pandemic is that this is totally cut off, there is no income coming in, and that is actually going to be the one that trigger violence, one of the major factors of triggering the violence, And at the same time, as Narayda pointed out, is a question of access. Now, before we move into access as a service, we are talking about access as awareness of information and availability of the services itself. Yeah. So whether the women actually, realize and know where to go, what to do, during this time, and that has been a critical issue. I think in our experience, I can only share with you my recent project at the moment. We started it from last year and this year, and we work with a community, which is really, I mean, like in Kelantan, for example, in Kota Baru, anything 10-kilometer radius, you can call it rural, but it's really, very close to the urban center. But at the same time, people do not know how to get access to information. They could not get access to information, right? And of course, at the same time, we must remember this is a question of, having digital or technology where you can really quickly, using your smartphone or trying to call people and all that. And in the community where you have a digital divide, where people, use a very basic facilities, and this can be a real problem as well. So there's a lot of issues, I think, that we need to check on the whole community, urban or rural for that matter, when we talk about the pandemic. But I think these are the what we have learned, and all this while we realize that we need to talk to people about the violence, domestic violence, and very few people are willing to talk about it because there's a lot of stigma, in this community to talk about violence openly. So, when you have the situation like pandemic, I think this really, pushed down the whole, effort of people to, to seek help and to really improve their situation.
Thank you, Prof. Siti. So I think you have brought up some very good points about the lack of access to information that's being one of the things that's stopping domestic violence survivors from seeking the help that they need. So Winnie, from the experiences of Sabah, can you tell us a little bit more about access to services and information in Sabah, and how are the women, the domestic violence survivors in Sabah, handling it in their way?
Thank you, Peyung. Good morning, everyone. Yeah. First of all, yes, the issues that are shared by the other three panelists, we see that happening here. But I think for Sabah, I would like to add that in Sabah, everything that you see in KL and so on in urban areas are far more exacerbated because Sabah is such a big state, and all the resources, especially that is currently with federal agencies, since they are the ones that are mandated under the ACTA to handle domestic violence, have spread really very thinly. And because during the COVID, all resources, especially police, hospitals, and kebajikan, are marshaled and focused to handling the pandemic. Yeah. So basically, domestic violence take a backseat. It's almost like it dropped off the radar. You know, it's amazing. I've been trying to reach out and find out what is happening to domestic violence survivors, and it is not easy. Yeah, I've only been able to have to talk to several people. Yeah, but what I like to highlight is the ones that are marginalized always, even without pandemic, but more so during pandemic. You know, women and children like from the undocumented communities. I remember getting a call one day during MCO where they are hiding, you know, women and children that from the undocumented communities. They have to hide. They can't come out of their house because the roads are all, the roadblocks everywhere, and they can't get food. So, you know, Prof. Siti is right. Access to food, you know, to money, simple things like that, that we take for granted, you know, marginalized communities can't get access to, let alone a telephone, let alone calling Talian Kasih. You know, I also like to highlight that in Sabah, especially in the more remote areas, it's almost impossible to get through to Talian Kasih. Even to get through to Kota Kinabalu is a problem, let alone to Kuala Lumpur. So basically, women and children that are facing domestic violence totally isolated during the MCO and even until today. Yeah. So that
Thank
is
you, Winnie.
yeah.
Thanks, Winnie. So our speakers have raised a lot of important points, explaining and elaborating on the difficulties faced by domestic violence survivors in the time of the pandemic. So we will later on go on to discuss what can be done from the advocacy and policy solutions point of view. But before I go into that, I just want to bring into attention that so despite the worldwide phenomenon, it's not just Malaysia, right? It's like every other country in the world, they're also reporting drastic increases in domestic violence cases. And but then for us, statistics from our government seem to suggest that there's no great or drastic increase. So if we remember the news reports that we were reading, the Ministry of Women said that, oh, the increase in calls is attributed to a lot of other matters. It's not just domestic violence. And even I remember reading in May this year, Bukit Aman actually said that, oh, we actually have less investigation papers compared to the same period last year. So, but I think as practitioners and advocates for the survivors, I'm just wondering, does your experience tell you differently, especially from the perspective of Chazana in WAO, where you are an active part of the situation, taking calls from survivors. So before I ask Shazana to take the mic, just want to show some statistics that we have both compiled in terms of distress calls. So if I can have the Talian Kasih statistics up. One moment, just need to put them up, yes. So these are the number of domestic violence calls received by Talian Kasih. So from March to August until the 13th. And we can see that the spike for Talian Kasih call domestic violence calls is in May, which is the period between MCO and CMCO. So let's have a look at the statistics from WAO. Yeah, so these are the numbers from WAO, and also May also seems to have recorded the highest volume of calls. So, but the difference I want to highlight before I go to our speakers is that for WAO, majority of their calls are intimate partner violence and family violence and domestic violence, whereas I didn't compile the breakdown for Talian Kasih because domestic violence calls are actually a very, very low percentage. So for Talian Kasih, their calls, basically the divide that you see is quite different. So moving on, so Shazana, can you tell us a little bit about the experiences of WAO during the lockdown with regards to the number of calls?
Yeah. Thanks, Pei Chung. Actually, I just want to highlight that from this slide, we can clearly see that in March, WAO experienced a little bit of an increase in calls, about 44% increase. But then you see then in April, there is 162% increase in calls and WhatsApps. And you see that this trend, this volume of calls and WhatsApps is quite consistent over the next few months. So in April, May, June, and July, that's just about a month ago. And so the calls and WhatsApps are still coming in. And so as you can see, in domestic violence is the portion in pink. And we see that when we talk about domestic violence, it's not just intimate partner violence, but it's also family violence. So it could be brothers or hitting mother and daughter. It could be father, uncle. So so when we say domestic violence, we're very aware that it's not just intimate partner; it's also other family members. Yeah, I think that needs to be clarified, but also that the other point that I wanted to highlight is that the calls and WhatsApps that we receive are analyzed by social workers who then who then identify whether survivors are experiencing violence. So if they are not experiencing violence and if it's just a relationship dispute, then it is the call and WhatsApp will be classified as a relationship dispute. So when you see, so that means all the calls in the pink category are really cases where survivors, it's calls where survivors have self-reported violence, okay? So whether it's physical, emotional, social abuse, so this is violence, okay? So the other point that I wanted to highlight was that survivors will, so not all of these callers will report their cases to the police, you see. So some may, although when they call us, what our social workers do is we advise or rather provide information to survivors about their rights to make a police report, to pursue the criminal justice process. But if they do not want to, then it is really their choice. And then that is, but then we need to be able to support them in other ways. Yeah. So not all survivors report cases to the police. So so it doesn't automatically translate to an increase in police reports. So I just wanted to highlight that.
Yeah, so actually on that note as well. So when we talk about things like data and statistics and like what Shazana had said, sometimes people don't report, and if it's not on a spreadsheet, doesn't mean that it's not happening in that sense. So I want to ask Prof. Noraida from the academics point of view. So how do you think that when we talk about the inadequacy and the unreliability of data, so in your opinion, how should this data be actually kept or analyzed? How should the gatekeepers be basically collecting this information in the most, how do we say it, the most accurate way possible?
Okay, thank you, Pejung. I think you were right in mentioning that the most countries reported drastic increase in domestic violence, and for example, even in China, because many countries in the world beginning February started lockdowns, different forms of lockdown. So there are reported cases around the world of increase. So like we have increase in China, triple cases are tripled for reported cases to the police. In Europe, in France, in Spain, in the UK, there are recorded increase of deaths due to domestic violence. So, and even the United Nations Secretary General made a statement for countries to respond to domestic violence during the pandemic situation due to the increase. So we do need to wonder then, you know, if the rest of the world are experiencing this kind of increase, you know, why have we not seen it in Malaysia, or why are we saying that the case may not be similar to in Malaysia? I think the answer really is in the way that we collect data, or in the way that we look at complaints or reports of domestic violence. So so whether or not we are in MCO, you know, before MCO or as a result of MCO, gathering data in the right way on domestic violence is really critical because we need to analyze the data. I mean, sometimes people use data just to show a number of cases. I mean, I think what we have seen, the numbers in the media, the police cases, the police statistics and so on, they are mostly to represent or to show that, you know, these are the number of cases that we have. And to say that, you know, we are happy because the number has gone up, or we are not happy, gone down, or we are not happy because the number has gone up. But in the case of violence against women, I say, you know, any case per any period are too many cases, you know. So we should not be saying that just because we have a certain number of cases per year, then we are okay. So the reason we collect data, so it's not just to prove we have many, only a handful of cases, but because the knowledge about domestic violence cases is essential in making effective policies on the issue of domestic violence. So knowledge is not just about how many cases we have, but why we are experiencing certain patterns of statistics. Whether the statistics point to certain trends in terms of geographical areas. So we discussed urban and rural challenges just now. You know, how do these statistics tell us about the type of the variables that are related to domestic violence, such as socioeconomic backgrounds, belief systems, and you know, belief systems that inform our ideas about marriage and so on. So while we can look at the numbers to give us an idea about the prevalence of the cases in our country, we must actually delve further in data gathering, for example, by establishing, as I said, the connection between incidents of violence with different variables, attitude, views, behavior about marriage, about violence, and so on. So, and concurrently, we must, for example, collate and analyze different voices of affected people, and analyze, you know, like survivors, advocates, policymakers, policy implementers, so that we can more deeply understand the multiple aspects of domestic violence. I mean, for Malaysia, let me just give some example of the data. I mean, you have shown some of the examples. The police have been tasked with recording reported cases that they receive, even ever since the Domestic Violence Act came into enforcement in June 1996. So in the last 20 years or so, we are able to know about a number of reported cases, mainly because there are question and answer session in Parliament requiring the presentation of the numbers, and these are reported in the media. And the numbers have grown from a little bit more than 3,000 in the early days to currently, in the last 5 years, we have more than 5,000 cases annually. So, but even this may not give us an accurate picture of the pervasiveness or prevalence of domestic violence, because I think the reason, if you just look at the police report, one reason is because, as Shazana said, I mean, these numbers are more likely reports or complaints that are reduced into writing. So when survivors come to report to the police, there is actually an obligation for the police to reduce the report into writing. But in one of our studies, we also found that there are many cases where interventions are done through advice by the police to the survivors. You know, this may not be domestic violence. You may not want to report this. It may cause you some issues with your husband later, and so on. So or there is a kind of persuading the victims or not to report, not to make a formal report, and so on, or to resolve it in different ways. So the number may have reduced because of that. And secondly, I think as basically has been mentioned, basically, so victims may seek help in different places other than reporting to the police. So it may not go to the police. Interventions may have been done at the civil society organizations where they seek help. And thirdly, the survivors may not come forward to report at all. So we may see a lot of women not coming out and reporting because they may think that, you know, this is something that is normal, especially emotional abuse, for example. This is something that is normal for them to experience from their husbands.
Thank you, Prof. Naraida. So if I can just very quickly go to Winnie, I'm guessing that Sabah would have a lot of difficulties getting data. So I'm just wondering how does SAWO handle getting the data needed for your work, basically.
Yeah, right. Thank you, Peyung. And I totally agree. That was very useful, Prof. Noraida, giving all the factors. We definitely see those things at work in Sabah. It is, first of all, it's very, very difficult for survivors to report to the police, to kebajikan or hospitals, yeah, for various reasons. For women in the rural areas, obviously, it's the accessibility. Firstly, they don't even know, like Prof is saying, they don't even know that they can report. So the first thing they will do is to go to their neighbors. So during MCO, if you live in a plantation environment, you can't move around and the houses are quite far apart. So you basically left to your own. So you can't tell your family, you can't tell your neighbors. Sometimes they will look for the ketua kampung. Yeah, and we all know ketua kampung are not trained in this. We will talk about this more when we talk about how to improve the situation. And these statistics, this number of cases are not recorded anyway. Yeah, so it's just kept at the village level. Yes, but in 2013 to 2016, SAWO, together with the, I must say, the International Work Group on Indigenous Affairs and 2 other local organizations, we embarked on a rural outreach program which covered 5 districts and nearly 15 villages. And we found that when we did a survey with our community key persons, that almost 50% of the women that were surveyed have experienced some form of gender-based violence, and for sure emotional is the highest, 30 to 50%, because they think that itu biasa saja. You kena maki hamun, you kena, all sorts of, denigrating remarks. Itu biasa saja. You can't even go to your ketua kampung to complain about that. So basically, I would not take the police statistics as something that is, an indication of the situation during MCO, and even if it's not during MCO, because for so many reasons, that is just a tip of the iceberg. Okay.
Thanks, Winnie. Thank you. So, Prof. Siti, just from your perspective on the importance of data collection, do you have anything that you would like to share with us?
Yes, just a little bit, Pejun. I just want to add to the points that Prof. Nuraida and Shazana and Vinny has put up just now. I think recently, during these MCOs, I mean, I heard some of our government representatives dismiss this calling as just a family arguments. And I think this is very critical, that people must understand what actually is the cause of the arguments, you know, right? And when we talk about triggering factors, you see, one of the major cause of triggering factors of violence is controlling behavior, where women are being controlled by men, and this can cause a lot of issues. This can cause a lot of arguments in the family, right? But that is actually an underlying situation of a violence itself. Yeah, so I think we must have a good understanding of the whole issues on violence, particularly among the public servants or the service providers, as well as among us, the civil society people, so that we are talking about the same thing. We just don't dismiss it as a family problem, just a small arguments, and that can actually put off some people from, going further for seeking help, to seek help, Yeah, I think this is very important. And also, like, I think basically, like what Prof. Nuraida mentioned just now, we do not show much about prevalence, but when you look at Winnie's data just now, yeah, we are talking about more than 25%, 30%, even 50%. A short screening program that we had in Reha and for Kelantan and Terengganu, for example, we had 389 women that we reached out in our service center, and already 100 of them, or which is 25.7%, actually reporting one type of violence. So if you look at prevalence, then that is, what has been said internationally, 1 in 4, 1 in 5, or 1 in 3. This is almost right everywhere, I think, in the world. Yeah, just to add to that. Thank you.
Okay. Thank you, Prof. Siti. So moving on to the last question that I have for our panelists. So we're now talking about advocacy and solutions. So because in the absence of a vaccine, I think we have to prepare ourselves for the possibility that periods of lockdown might be repeated now and then, here and then. So what are the most important steps and policies that we need to put into place as a forefront would be my question. But at the same time, I also want to discuss just a little bit about existing interventions. So Prof. Nuraida, if I can have your opinion on the existing interventions as of now, are they helping or are they hindering in your opinion?
Okay, thank you, Pejung. I think we have interventions. I would like to propose the due diligence project proposal on the 5 Ps. The way to handle the violence is through prevention, protection, prosecution, punishment, and provision of effective redress. So these are 5 Ps that have been used by the due diligence project, which is a project under the International Human Rights Incorporation, looking at violence against women. So I think in terms of prevention, generally the civil society and government also have done some measures of prevention. In terms of protection also, we have the Domestic Violence Act 1994, which has also evolved by having amendments and so on. But I think the third P, the prosecution and punishment, is still our issue. For example, when we talk about the data, although about 5,000 reported cases of domestic violence a year we have at the police, what we need to ask further really is what happened after these cases are reported. What are the interventions, or what are the response that are given to the reports? Because we still see an issue of how do police, for example, reduce the report into the different types of crimes in the penal offenses in the penal code, because that is how our law still works. That means the Domestic Violence Act did not clearly says that domestic violence is a crime, but the Domestic Violence Act actually tie the act to the penal code. by saying that it must be read together with the penal code. So if you can identify behaviors in the penal code that is consistent with the definitions of domestic violence in the Domestic Violence Act, then you can proceed with the case. So and I think the issue still remains. For example, there are two types of offences in the penal code, which is seizable and non-seizable offences. So it means that if the offence or if the complaints of domestic violence is considered to be one of the non-seizable offences, like causing hurt, slapping is still the definition of causing hurt. There is no immediate requirement to do investigation. It may take time to do investigation because there are procedures that you have to follow before the police can go out and actually investigate the complaint. So I think in terms of response, the part on prosecution, which includes investigation, punishment, and effective redress to the victims, are still something that we need to look into and improve on. Thank you. You have to unmute yourself, Pejung.
Sorry about that. Okay, thank you, Prof. Narida, and thanks for the reminder. Prof. Siti, so you have done a lot of work with the one-stop crisis centers, and definitely the crisis centers are one of the basically solutions that is set up to help domestic violence survivors. Can you explain a little bit more about how the one-stop crisis center is operating in the pandemic, and has it been effective as a solution?
Before I go on, I saw Shazana's hand just now. Maybe Shazana wanted to say something first, yes?
Oh no, I was just trying to signal to Pejung tadi about the...
Sorry.
All right then. Yes, we know that Malaysia actually has one of this model of one-stop center in the hospitals. And this is one of our well-known health models responding to violence, interpersonal violence and family violence. Yeah. I cannot talk about the nationwide response because I do not have the information at this point. I'm still having exchange of information with my colleagues either at MOH or at the local Jabatan Kesihatan. But I think from our experience in HUSM, for example, we do not see much more than the regular number of people attending. So that worries us. Maybe it's the very case that women could not have access, to come to the hospital for services. But at the same time, I think this is during the pandemic. This is what I can remind my health sector's colleague, whether we are actually being more alert in our support for women and family members who are experiencing violence, because I think it's sometimes the women will not probably tell much during their session with the medical people or with the health care personnel, but at this point where you need to ask the right question. Don't just ask them like, are you safe when you're going home? And that's not good enough. I think you have to understand what safety means for them, and how can they actually be supported during this time. I think we need to do more, but I hope my colleagues in the health sectors are actually doing that, to help women who attended OSCC. Now, beside that, beside OSCC and SCAN, for the child abuse, as well, we tend to sometimes forget to ask questions when we are accepting child abuse, patient. We forget to ask question whether there is intimate partner violence at home. We tend to only focus on whatever the injuries or whatever that comes in. So I think this can be improved, yeah. But over the years, I must say, first of all, over the years, the OSCC has actually improved a lot, in terms of its services, in terms of its availability, in all hospitals in the country, especially those with specialist hospitals, and those without are supposed to do the necessary referral, but I suppose, we haven't reached the optimum level. and we still have a lot of, room to improve ourselves as far as our service in the hospitals is concerned. But I must say that the women actually find it quite satisfying. I think we had some studies by some postgraduate students that, hospital responded well to them, to their needs, not just, their physical injuries, but they do have medical social workers or psychiatrists and all that also support their psychological issues as well. Yeah, thank you.
Thank you, Prof. Siti. So now I just want to talk a little bit about collaboration and cooperation in that sense. So Winnie, so I just want to ask you from the experiences of Sabah, how important is cooperation and collaboration between the state and community when it comes to advocacy for domestic violence survivors?
Thanks, Pejung. I'm going into that in more detail, but before that, I totally agree with Prof. Siti. We see the improvement in OSCC over the years. Of the 3 frontline agencies, OSCC under Kesihatan is the best, yeah, the improvement. Of course, Prof. Noraida is saying the 5 Ps. I wish we have even some of the Ps here, but in general, I'm sorry to say the 5 Ps are not yet established in Sabah. Yeah, I mean, Sabah has been in the forefront of this campaign right in 1985-86, where we didn't even have an ACTA. Now it was passed in 94, and then it came into effect in 96. And until today, the establishment of the 5P system is very, very weak. And it comes in where it dribbles, I would say. It comes because it's a federal response mechanism or system. It ties into the 5-year Malaysia plans. If you miss this Malaysia plan, you got to wait another 5 years before you can even go and talk about asking for a shelter. So as a result, in Sabah, it's so sad, we do not even have a shelter that is federally funded at the moment that is dedicated to domestic violence survivor in Sabah. Yeah, so that is the situation. Don't talk about protection, prevention, there's hardly any awareness. Awareness is always given to NGOs to do, but it should be collaboration. So we come to the issue that, the point that Pei-Yung is asking about collaboration. Yes, it's very important. So in this case, I must say the state and local authorities have not pulled their weight as far as confronting domestic violence is concerned. We cannot just depend on the federal, just because it's an ACTA and it's a federal responsibility. So given how slowly the federal framework gets implemented in Sabah, the state, I think, has a responsibility to step up, because we have our own state resources, we have our own state minister and machinery departments, and they should collaborate. Then there need to be better collaboration between state agencies like the Women's Department, like the Kebajikan, to work closer with the federal measures that are already existing. Example, in interdepartmental agency meetings, I think, Shazana, we have been talking how Sabah is normally left out in this kind of discussions which happen in Putrajaya, so even the federal officer in Sabah is not involved in this. So basically, we are left out in the national picture as far as progress and and doing improvement. But having said that, again, I stress, as been shown by our project in 2013 to 16, that if we put in more effort to developing local resources, village level resources, like community leaders, like Ketua Kampung, like the JKKK, which is the MPKK, they have the institutions there in every village, and they are quite well developed. Why don't we pour in some resources to give training so that they are aware that domestic violence is a crime? Most of these community leaders, they don't think it's a crime. they don't know what to do. They basically tell the survivor to say, okay, it's okay. He's just having a bad day. Just go home, you know. So nothing gets done. So we need to train the Ketua Kampung, the JKK, and then we have to train the Mahkamah Anak Negeri, because like it or not, this part of the society in Sabah, as you all know, we have three parallel systems, you know, especially on the ground. We have the adat laws, which basically for a lot of indigenous communities, it's the most important law, right? Because it's accessible, it's your village, your ketua kampung, and then you don't need a lawyer, you can speak for yourself and so on. It's so much more accessible. But unfortunately, they don't know how to handle domestic violence. You know, they don't even have a law for that. So I think discussions can be started. And I know that our previous chief judge is saying that he would like to do more for domestic violence under the adat. Then we have the Sharia. So we have to work with the Sharia authorities how to develop community and local resources. You know, where do women and children go for help? Not necessarily to the police, because most of the survivors that we talk to, they don't want to make it to put their intimate partner or their husbands to prison. They just want the violence to stop. Yeah, so you know, reporting to the police is one thing they are afraid to do, because they don't want to put the breadwinner into jail. Okay, so we have to develop the other aspects like community support, so that, you know, women and children have access to some temporary shelter. And then when community and family rally around the family, as we all know, you know, situation can get better. The abuser will feel, you know, that, you know, he can't do whatever he used to do and so on. We have seen that, and there's a lot of potential for that. So this is why there have to be more resources for the local, which is the village level, and at the district level. Yeah, so that's where the Ministry of Local Authorities come in as well, all the councils and so on. Yeah. So
Right.
I'm very
Thanks,
hopeful
Winnie.
on that end. Yeah.
Thank you, Winnie, for sharing your thoughts on what best to do in Sabah. So just before we go into Q&A, I just like Shazana to quickly go into WAO's work on multi-stakeholder initiatives, because I think that's what's been happening with WAO in taking it to the ministry and trying to basically put in place, implement a plan that's best for domestic violence survivors. So Shazana, can I have your thoughts quickly?
Yeah. Okay. Thank you, Pei. So actually, I think Dr. Narida spoke about, you know, the 5 Ps, and Winnie spoke about empowering local communities with resources to respond, and Prof. Siti also spoke about the OSCC and its importance in the whole process. And I think to kind of tie all these are all really critical ideas, and it boils down really to what we think is a comprehensive system to respond to domestic violence nationally at various levels. And so and we all know that the response to domestic violence often involves many agencies. You have the social welfare department, the police, the hospitals, the court, etc. So it's what WAO has been trying to push for is better coordination between these agencies at various levels. So just last year, we saw that the Domestic Violence Committee was formed at the federal level, and as Winnie says, not everyone's interests are being represented in that committee, but it's a start, and it's something which we can work on, and so that is one. But the other thing that I wanted to highlight, Pejung, is that what we need to do moving forward, given that COVID is MCO could happen again, is that we need to integrate a GBV response in our crisis and disaster preparedness plans, because when we go into MCO mode again, we don't want to have to deal with all the uncertainty surrounding access to protection. We don't want hotlines being shut down and then suddenly up again, and these kinds of things. We need to be ready and consistent and available. And I'm talking about our essential services, the crisis hotline, the shelters, as well as psychosocial support. And in order to make sure we're ready for that, we need to look into our essential services and resources. So that's another thing that WHO is working on. We've been lobbying the Ministry of Finance to increase resources. So we talk about plans of improving this and that, but we need to put the money where it matters. Yeah, this is sum it up.
Okay, thanks, Shazana. So we're going to move into Q&A, and given the time, so we might actually run a little bit over time, but I think we have time for 2 questions, say. So from the chat box, so just want to ask this question from Akmal Zulkifli. So over the years, GBV interventions and avenues for redress by authority with the civil society have made some considerable progress. However, with the MCO and the pandemic, it seems that this progress has scaled back or regressed. So what are the best possible ways that we could prevent or at least minimize this regression in order to ensure that the progress can be continuing forward? Any of the speakers like to take it? What about Prof. Siti? Since you also mentioned just now about how there's been regression going on due to the pandemic. So in your opinion, what are some of the things?
Can I divert that to Naraida first, Naraida? Because I was just about to type an answer. Sorry. All right.
Okay. Well, I think the first thing is really to admit that there is a problem. That we do need to relook at our data. For example, we do need to relook at to question the data in terms of is it true that we are not experiencing too much of a problem with domestic violence, because the data seems to show that the numbers has not increased. So I think to interrogate this situation is very important. And and really to look at, because studies around the world have also shown that in times of crisis, there tend to be increased. So over the years, it doesn't matter whether it's the COVID pandemic or other situation of crisis, natural disasters and so on. There is a show of increase or heightened forms of violence in the context of family, domestic violence, and so on. So I think we need to be on the alert when MCO happens again, for example, and we need to see how different agencies can be coordinated in order to help. So there should be more serious relooking into this. So okay,
can I just add up a little bit more? Yeah, I think what we have learned from this experience the last few months, for example, is how the government should be working with civil society. And as Shazana has pointed out, I think from the very beginning, we must have it very, very clear that, the civil society are real partners to the government, and not just complementary. It's just they are just real partners, particularly for the case of domestic violence, because I think that the civil societies are the one on the front line that has been pushing these issues for this country for a long, long time. So they have to be recognized, I think, and therefore, the whole context of collaboration has to be, taken seriously. It's not just, by the way, that kind of a situation, I think. Yeah. So, I think it's not just during this pandemic when many studies have shown us, as Prof. Nuraida mentioned, as particularly for natural disaster studies, for example, that we can learn from, is post-pandemics is going to be another problem as well. And if someone is suffering psychological problem now, post-pandemic probably going to be worse for that person if there is no way of attending to that person or helping that person, So I think it's not just a question of servicing the MCOs, but also post-MCOs that will take another 2 years or 3 years after that, and how we're going to get people to any sense of normality in their life, and which is going to be a very, very long time. Thank you.
Pei-Yung, can I add to that? Pei-Yung, can I add a bit? Well, in Sabah, we can do something even more urgent. Our state election is coming up on the 26th of September. And we have always been in the forefront to try and put domestic violence or gender-based violence on the agenda during election. Why? Because, for years, like Siti was saying, after the election, when people win and they get all the posts and all that, and you will find that there will be not much focus on gender issues, especially, and children, children's rights. So these kind of issues fall to the wayside. So we have been working with women and community groups to bring their concerns to their wakil rakyat, to their adun, because we're talking about building local resources. So that's one of the objective of our rural project, is to help women to verbalize these issues, because most women and community leaders don't think gender-based violence is an issue, is a development issue. They think that it is just a remeh-temeh and a personal and household problem, okay? But it's more than that, we all know, So we have been working with women, especially the ones who have leadership, to be putting this, asking the local calon-calon, like, I think in the long run, maybe not now, but it will. I'm beginning to see that they are calon-calon, the prospective candidates who will be speaking up on this. And in fact, this election, I'm happy to say that parties are mentioning about putting more women candidates to run, because they are seeing that there is a potential that, women are voters. We are 50% and we are more than 50% of members in political parties. That's another one. So to answer the question to, no, I'm sorry, I forget the name, but I think this is a way to go. We have been asking and begging for 30 years. I think it's about time women bring the change themselves, rather than expecting leaders to be, giving us some of their time and to look into this issue. I think women should be the ones bringing up this issue and saying that it is an important issue. It happens, it is impacting every one of us. It's a national issue.
Thanks, Winnie. So I think we have time for one last question, if I can take another 5 minutes of everyone's time. So we received this question from, I think, the embassy's Facebook page. What are your expectations on any rise of domestic violence cases due to higher unemployment? Is there any correlation? So if I can maybe ask Shazana to take a stab at it, because I'm thinking whether through the calls WAO, did anyone cite things like unemployment as a reason that they are facing intimate partner violence and so on?
Yes, I think unemployment is very interlinked with the increase in violence. But I say this from our observations and from anecdotal evidence from our cases lah. So, but basically, we see that with unemployment soaring, you see women are less certain about their financial situations and their financial futures, and therefore are more reluctant to leave an abusive situation because they are highly dependent on perhaps their husband who still has an income, or maybe doesn't have an income, but basically they're hanging on to what they already have. So that in a sense can exacerbate a situation for a survivor. And the other thing you see for survivors who have already left and who are trying to make it on their own, independently living with their children, it becomes a source of stress for them. And so this situation is more related to post-crisis lah. So these are two ways in which unemployment can affect survivors.
Thank you. Prof. Siti, would you like to share your
Yes,
thoughts?
I just want to add a little bit more. Just now, if you remember at the beginning, when I mentioned about financial issues as the major triggering factors. In fact, in our study, when we rank it, financial is one of the, financial is a top major triggering factors. So if unemployment is related to financial issue, then it will be one of the major, triggering factors, because the top 5 triggering factors is just financial, jealousy, substance abuse, controlling women, considering women not obedient, and no particular reason. These are 5 top ranking about why violence happened in the relationship, in intimate partner relationship. So what happened is that as I mentioned, in places where people are just daily wage earners, for people who are daily wage earners, they did not consider unemployment as a critical issue, because they sort of used to the idea that sometimes I have work, sometimes I do not have work. I mean, like, maybe the word used to be not be corrected, but correct, but but still they are able to actually adjust themselves. But when someone who used to work and suddenly do not go to work at all, and that would probably cause more a psychological problem first before it goes into the whole context of financial problems, you see. So I think definitely we should worry, because if so many factories, so many organizations are closing down and there are more people who are unemployed, and this can be one of the issues that can increase the domestic violence in our country. Yeah, thank you.
Thank you, Prof. Siti. Prof. Narida or Winnie, do you have any thoughts to add to the matter regarding unemployment and domestic violence?
Yes, I think, I mean, as I mentioned, that the studies about disaster or crisis situation, like for example, the International Rescue Committee in 2015 found that a situation of emergency will cause structural and interpersonal norms and relationship disruption, will increase the domestic violence. So, so these are the situation where economic situation is a disruption to relationship. And also, I want to relate that to our own findings in our prevalence study, that emotional violence is also the highest form of violence reported by our respondents. And sometimes these are not captured in the police statistics, for example. As I mentioned, emotional violence may not be something that, so women reported in our study because we asked whether they have experienced this kind of violence, but it is not something that they may be reporting. So although we expect we suspect that the numbers are high due to unemployment, because it will create a situation of emotional abuse, being being angry at basically it may not just lead to physical violence, but a constant emotional abuse of family members due to stress situation. But this may not be reported, so we may not see the statistics about this in the official statistics. But definitely the abuse will be exacerbated by the situation, by the challenge to the economic situation due to unemployment. Thank you.
Thank you, Prof. Narida. Winnie, any thoughts?
Just to reiterate, to support the issues brought up regarding the lack of economic support as a triggering factor. That is so true, yeah, because in Sawo, we also help to distribute food aid of the Maikasi Foundation. And this is tied into our work to support families facing domestic violence and other forms of abuse. And we always see the impact of the food aid to the relations within the family. Yeah, you can almost see that the tension, the relationships so much better when the man has this burden taken off his shoulder, because the women will be going to get every month the food aid. I think you all are familiar with this. Yeah, they go to the supermarket and then they bring home the essential food or items that they need for the household. So basically, from that, the women don't have to be asking the men for money for the dapur. Yeah. I think in our survey, we also see the reason why men beat up the wife is because she keeps asking money, because she has to buy food or kitchen essentials to prepare food for the family and for, and so on. And it is always a cause of conflict, yeah, because the men cannot provide. So if the women are getting the food aid, so that is very important. We need to give the food aid package to women. I think in Sabah during the MCO, there were some districts that were not giving it to women in the beginning. So that caused a lot of problems. Yeah.
Thanks, Winnie. So I think that's all the time we have for today. And I'm very sorry that I've gone over time by 8 minutes. So thank you everyone for staying with us till the end of this webinar. I think it has been the most fruitful discussion. We have heard from all our panelists on their thoughts on the challenges, the importance of data, as well as advocacy solutions from different points of view. And I'm sure that this conversation will be continued offline with everyone as well. So a thank you email will be sent to all the participants, and our speakers' email contacts will be included. So if you have any more specific questions for our speakers, please feel free to reach out to them to have a discussion regarding your points of questions and discussions. So once again, thank you so much to everyone for joining us today. I hope it has been a very fruitful session to all of you. And once again, a very, very, very huge thank you to all our speakers for your time today. Thank you very much and have a good day, everyone. Thank you. Bye.